Well, COVID-19 is clearly now a part of our everyday life. And for those people who have suffered with the disease, what is it that they're facing? What is the next step? What will happen to the rest of their lives? I've invited Dr. Avital Harari, one of our contributors here on Carlos and Lisa and BEONDTV, to talk to her about what I guess is long-lasting effects of having COVID-19. Dr. Avital, nice to have you with us.
Thank you for having me.
So what do we do now? If you've suffered through COVID and you're feeling better, but you're still going to have issues, whether it's organ issues or some lung issues, what are the issues going to be?
Yeah, so just stepping back, when you get COVID, about 40% of people will be asymptomatic, so no symptoms. And then this other 60% will have symptoms, and they can range, anything from shortness of breath to severe symptoms where you're hospitalized. Of those 60% who have symptoms, so mild to severe, about 65% of them will end up feeling back to normal within about 5 to 12 days. The CDC did a study. Mm-hmm. About 35% of them will be what we call these long haulers, where things just aren't exactly normal. Things don't go back to normal so quickly. On the studies that they did, about 2 to 3 weeks after their diagnosis, these people still had symptoms. So what were those persistent symptoms? So the most common thing would be persistent cough or shortness of breath, fatigue, like very tired, brain fog, difficulty concentrating. There are people who have aches and pains still persistent after their diagnosis and after recovery. They lose their sense of taste and smell. Sometimes this doesn't come back for several weeks. And some people will have a headache, chest pain. So these are kind of some of the things that these long haulers, that is what they're calling them, are continuously feeling after their diagnosis.
So is there a period of time where this will disappear, or are they going to live with this the rest of their lives?
So we don't know. This is such a new virus to us, and we're just now, discovering that these people exist, right? That only in July, August was when a lot of these studies were done, because they started seeing that people were having these persistent symptoms. We don't know why the symptoms are happening and why they're continuously happening. So what can COVID do to your body? So we all know about the respiratory issues and how it can become so severe that you need to be on a ventilator. Sometimes your body will overreact. Your immune system will start to overreact in the middle of the moderate, people who are in the moderate range where they're in the hospital but not quite on the ventilator. And that overreaction of their inflammation will cause them to be in the ICU because they're almost like drowning in their lungs. Mm-hmm. But additionally to that, it can affect your heart. People can get heart failure from it. It can cause blood clots, which can then cause strokes. The blood clots can cause clots that go to your legs and then up into your lungs, and pulmonary embolus, it's called, also another issue with shortness of breath. It can cause things called another disease called Guillain-Barré syndrome, which is basically where the virus attacks the neurons and the motor neurons in your body. And some viruses can cause this. And they've seen it with COVID as well, where all your muscles basically stop functioning, and then you have to be on a respirator for that as well. So because of all the ways that COVID interacts with the body, we don't know what's going to persist and what's not, and how long it's going to happen, continue for. Some people think that the persistent disease is because of how it affects the blood vessels. So we think that the clots happen because the virus can attack the blood vessel wall. It has the same receptors as some of the receptors in the lung, and that can form these blood clots, but it also might cause, we don't know, temporary damage, permanent damage to these blood vessels. And so how long does it take the body to repair that? Some people think the cytokines, the inflammatory compounds that I was talking about, can cross the blood-brain barrier and get stuck in the fluid that's surrounding the brain and the spinal cord. And how long does it take for that to sort of get out of get filtered out? We don't know. So because most people recover within 5 to 12 days, what is it? Some people are months out and they still feel kind of.
I would think that this is a real challenge for a doctor treating a patient who may have gone through this, trying to figure out now what's wrong and how this COVID-19 has affected the overall health of your patient. So it's almost like an unseen disability that you can't really put your finger on. So how tough is that going to be?
Yeah, so it's really hard. I will say that this is not the first virus causing what's called a post-viral syndrome. A lot of viruses have done this. It's just much more in the forefront right now because people are getting COVID more than there are other viruses, thankfully, because people are being masked most of the time. But what we don't know, there has to be more research into this post-viral syndrome specifically for COVID because COVID does things that other viruses don't do. So how can we approach this? We need more research. For now, we're just doing symptomatic control. Are you having trouble sleeping? Can we do sleep hygiene? Don't start exercising right away after you had COVID. Get some gradual exercise. Your shortness of breath might continue, and so it might hinder you from being a little more active. We just have to take the symptoms as they come and kind of treat them symptomatically, and then hope that more research comes around that sort of, because we're going to have a lot of post-COVID syndrome because of look how many millions of people are being affected in the world.
Yeah, it's pervasive now, and I think that's something that we're going to have to live with. The question is, what's next? Those of us who fortunately we've not contracted COVID-19, but we know a lot of people around us who have. How should we behave? What should we be doing? And what can we do to help those people who have gone through it?
Good question. I think if you're around people, hopefully you're around them after they've gone through the recovery phase that they are not infectious anymore. And then you can help support them. Let's say they live in your house and they're really short of breath or they have a headache. Try to be cognizant of these things, and be tolerant of them and sort of help them through their symptoms. Some studies have been shown to see who's more likely to get this post-viral COVID long hauler situation. And it's much higher in people who have chronic illnesses. So if you have greater than 3 of those chronic conditions, like obesity or heart disease or diabetes, et cetera, a study showed that at least 60% of them are in that, long hauler phase. The older you are, more likely to be a long hauler. If you're hospitalized, 3/4 of you will have long hauler symptoms. So if you knew somebody who was in the hospital and hospitalized, that means they were severely symptomatic and they're in the hospital and they've been discharged. More than likely, they're going to have these symptoms that last, we don't know how long.
Yeah. Well, Dr. Avital Harari, thanks for the great information. Really very detailed there. And let's hope that folks don't treat those who have suffered through this like a scarlet letter, that we help them out, because emotionally, I think this is also taking its toll, but that's a subject for another conversation. Dr. Avital Harari, thank you so much for being with us.
Thank you for having me.